Thanks so much. And Jen, do you need to share your screen or anything?
Do you have my slides? No?
I don't see
Yes,
it. Maybe Kathy does.
You do stuff?
Kathy, I do too, but we had sent them. I can maybe not sure if I know how to
Yeah,
share.
I don't know how to do Zoom at all.
Yep. Kathy, do you need me, or Mary, do you need me to send them to you to be able to share them again?
Actually, or can you share stuff?
Yeah, Steph, if you share in this drive, that's great.
Okay. Let me find it. I'm sorry. Just 1 minute.
No.
Um,
How about if we have a race to see who can find it first?
Yeah.
I just had it. Sorry.
No worries.
Find it.
While you're looking, Steph, just a quick reminder, those of you who jumped in, good morning. Great to see you. We're using the chat to do our quick intros, your name, your agency, and then at the end, remember, we'll do agency updates. So I'm really glad you're here. It's a beautiful, beautiful sunny day. If you did your morning walks, it was a little slippery, but it was great to be in nature today. It's not as blistery.
Steph, I did find it.
Oh, did you? Okay.
Did I beat
I'm,
you?
I'm trying to open it, but for whatever reason, it's not opening for me, or it's taking a really long time. So thank you, Kathy. Sorry about that, Jen.
That's okay. I think one's the PowerPoint and then the other two are the marketing materials. So those could just be attached in the chat, and then the PowerPoint's fairly short. And I'll just have to go through those slides.
Okay.
Okay, I think.
Hmm.
Oops.
I see my little chickens out this morning. They're pretty darn happy to be out in the yard. They look like it's spring. I hope we don't get another snowstorm.
Right.
Yeah, they think spring has sprung. I'm like, oh, little girls, I don't know. This is Minnesota.
Okay, Jen, can you see it?
Mm-hmm.
Okay, oof.
Yeah.
Good job.
So would you like me to start presenting? We'll keep it the same, me going first. That would be good.
That's beautiful. Thanks, Jen. So glad you're here.
Okay, sure. So everybody's on that you want to start? Okay. So I am Jennifer Agen, and my day job is directing the Faith Community Nursing Program. So some of you might know me from that. I work with staff with Lakeview Foundation Community Health. And so I've been in this position for about 7 years and sit on a lot of boards and do a lot of meetings such as Connect and those type of things. And so probably about 4 years ago, there's always a buzzword, and that buzzword just really seemed to be grief, that we didn't have enough grief resources in the St. Croix Valley. We do have a few faith-based ones, Grief Share, which a lot of my faith community nurses run. However, those are structured a little bit different than a grief coalition is, and they're also faith-based. And so I had an education for my nurses and community health and hospice and home care and just a few partners for those of us who are dealing with people with grief to kind of help us help them. And I think at the end of that training, we all went, wow, there's a lot more to know. There's a lot more to do. And it just kind of gave that impetus for us to do more. And so Dr. Janice Nadeau was the one who had done the training that I had organized. And she just looked at me and said, I really think we're onto something. I think there's some energy here, and I think we should call a meeting with community partners to see if anybody would be interested in a grief coalition. At that time, I had no idea what a grief coalition was. However, Dr. Nadeau had founded, I believe, 10 of them in the metro area. And so she said, we really are missing one on this side of the city. So fast forward about 6 months after that, we met in April of 2023. And if you want to go to the next slide, I think it kind of goes into a little bit of the history. So we had a meeting. I just kind of asked partners like you, Dr. Janice kind of asked partners, community health. It was just kind of, we took everybody that we knew in our professional and personal circles and asked them if they would be interested in coming to this meeting. We ended up having 41 people at that meeting and another 15 that said they wanted to come. And it was just an amazing meeting, and everybody was just very, and it was composed of community members, churches, businesses, hospices, just kind of everybody. And at the end of the meeting, people said, this is something we need to do. I was given 3 checks to say I'll support this work, and I didn't have anywhere to deposit the checks. So a lot of passion surrounding this topic. And so what we at that point started to do was meet on a monthly basis. And we massaged out a mission. And then every meeting, we eventually got donations. We eventually got a website, a phone number, an email, and just kind of the St. Croix Valley Grief Coalition was formed. So our mission on the bottom of the slide is addressing the experience of loss and grief through support, education, and advocacy. So if you want to go to the next slide, that would be great. So we have the coalition, and that's kind of the mother organization, I guess I would say. And then what we said as part of our mission, what we are able to do at this time is we offer 2 Growing Through Loss sessions or series each year. So every fall and every spring, we will be offering what's called Growing Through Loss. It's a 6-week series, and how it is structured is it's free. There's no registration required. We have a host site, and we pick that host site within the community. We've tried to we did our first one at St. Andrews, our second one at Trinity Lutheran, and we're doing our third one at Shepherd of the Valley, trying to hit different pockets as far as area. And we are religion neutral. We are not faith-based. However, we do hold our series at churches only because they are the only ones in the community that have the space that we need, and also that they don't charge us. There are a few places that maybe we could use, but they're very, very expensive. So we have held them at churches. And how Growing Through Loss is structured is so we advertise it like I'm doing this today, telling you that this is here in our community. We put up flyers. We have our distribution list is about 400 now. So we kind of just have funeral homes and churches and, family means and Washington County and all those people on our distribution list, and trying to get the marketing materials for our Growing Through Loss sessions out because we are a new resource. But hopefully people hear about us and then they come to the series. We have each individual or family fill out a card, and on that card, it will list these losses, and you pick a loss that you would like to work on for the next 6 weeks. So many people have had multiple losses. However, we just really ask that you pick one loss and that you concentrate on that loss for those 6 weeks, and then you come back and maybe work on another one. And so with that card, they're turned into me, and then we form groups based off what is there for that particular evening and for the series. Attendees go to a 45-minute presentation, and they receive education on grief. So it is not on a particular type of grief. Dr. Bransford speaks for us every time, and he goes through the physical changes that your body goes through when you're grieving. Dr. Nato speaks for us at most of our series, and she goes through how she has a mobile, and she goes through how when you lose, a father, how the whole mobile is affected by those losses. And so we have we've been blessed with very qualified speakers. And so everybody gets that grief education. Anybody can come to the education without them staying for a support group. But what we encourage people to do is go to that education, and then we have a little bit of time to get some coffee or tea, and then they break out into support groups, and those support groups are for an hour. And so we have trained facilitators, most of them dealing with the loss that they're facilitating. Sometimes it's a doctor, like Dr. Bransford does our health changes and disability group, but most of the time, if it's a loss by death, that facilitator has lost a child or they have lost their spouse. And so attendees then go into these groups for an hour, and everybody within that group has had the same loss as them. So that's why a grief coalition, when I was saying, is a little bit different structure, is that a lot of grief support groups that you go to, you're in a group and it might be they lost their husband, you lost your child, somebody else lost their grandparent. And it's not that those can't be effective, they are, but these have been found to be much more effective only because you're with people with that same kind of loss. We've been told a lot, especially in our suicide violent death group. We've had people that have said, I haven't ever talked about this because I never felt comfortable sharing the details, but I do in this group because everybody kind of understands that type of loss. So in addition to loss by death, we do have the suicide violent death group, health changes or disability, current caregivers, and then divorce or relationship change. And caregivers, it just depends. Our group is quite large. If there's dementia caregivers and non-dementia caregivers, we do try to separate those out. And we're going to for sure try to our next series because we have two very qualified facilitators, because those, there's always caveats to a caregiver just isn't a caregiver. A dementia caregiver kind of has a few different challenges than maybe a normal a caregiver that is non-dementia. So I think you can go to the next slide. So this is just a disclaimer kind of saying we are made up of individuals, Minnesota and Wisconsin. We're non-faith based, holding our Growing Through Loss series in various churches in the community, not associated with any church or faith, and that just all are welcome. We really felt strongly about that. We have a couple people on our steering committee that really just look at everything through that lens. Like, are we being inclusive? Are we, what was that? Did somebody say something? Oh, maybe somebody just wasn't on mute. So.
And I think you're on mute now.
Oh, that's weird because I didn't hit anything. Weird. Anyway, I heard somebody else. I thought somebody had a question. Sorry. So anyway, this is just kind of our disclaimer, just encouraging that all are welcome. And the reason why we don't have registration, it would be a lot easier if we did, is we know that people grieving just don't know what they're going to feel like that day. So we could have people register and not show up. You have people that come and they can't get out of their car. It just really depends. We've had people come that's 4 days after their loss, and we've had people that it's been 35 years. So this gamut is so wide that we just want to be the most inclusive that we can. And we feel like by not having registration, people know they can come or they don't have to come. And if you come to the first one, you don't have to come back. You could come to the third one. Every night is in itself, you can come. But like I said, to really get the benefit, we do encourage people, if you are able, to come to all 6 weeks. Next slide, please. So we had our first Growing Through Loss. It was about a year after that first meeting. So in less than a year, we actually, the Grief Coalition was on its feet, and we had our first series. The first series, like I said, was held at St. Andrew's Church. We had 164 people, and that wasn't on one night. So these are a little bit confusing sometimes, but because people can come to one or they can come to all 6, the 164 were 164 different individuals came during our 6-week studies or 6-week series. The 526 sessions was maybe one person attended all 6, one person only one, but there were 526 sessions attended throughout the 6 weeks. We had 15 volunteers, 15 facilitators, and a total volunteer hours of 598. So very good turnout. It was just, we felt very, very positive about our first series, and it exceeded our expectations. So the next slide, please. So second one was the fall one. That was at Trinity. Again, numbers were almost identical, which is interesting. I mean, we're still learning, so we don't know what that means. We had 168 individuals, 500 sessions, 15 volunteers. And the one thing that changed was we decided to try to have 2 facilitators per group. So some of our facilitators, they do that as a profession. They're very proficient. But for 2 reasons. One, some of our groups got very, very heavy. They got the suicide violent death was just a very heavy group. And so to just give a little bit of support, we now have 2 facilitators. So there's certain groups, certain facilitators are just not qualified to facilitate alone. So we have 2 facilitators in that group. And sometimes we just take vacation. And so for consistency of groups, we really want, other than sickness, we really want one facilitator to be there the whole time, so that because the trust and just everything that happens within that group, we just found that very important. So for our next series, we are also trying to find 2 facilitators per group. So our facilitator numbers went up, and then the total volunteer hours went up too. So next slide. So this is for our 2 sessions that we have done. These are the totals. And why I am here is we're embarking on our 3rd series next week. And so we hope to, greatly add to these numbers. You can go to the next slide. So it's, we didn't know what we would get. We didn't know how many, we didn't know the representation, but this is from the 2 series we did. There was many, many counties represented. We did try to provide transportation. We had 3 just drivers that would pick up people at their homes because they couldn't drive at night, bring them, to the series, and then bring them home. Amazing volunteers. We also provide childcare if it's needed. We ask people call the line and let us know ahead of time. That is one thing that's really hard. We had it at our first series and paid somebody all 6 nights, and it didn't get utilized. So we really encourage people just to call or email us and tell us their need. And we really, really do our best to try to get you to this series. And then just kind of how people are hearing through growing through loss is through family and friends and churches, pastors, hospices, and hopefully now through you. So next slide. And then we use the Likert scale. So we are very fortunate to have Dr. Nato. She's got a ton of titles after her name. I don't even know what they all are. But she is our consultant. So what's been really nice is I maybe can organize the things, but I am not a grief expert. I do have community connections, community, health that supports me. But I do not have the titles to back grief expert, but Dr. Nato does. So that's been really helpful just with how we train our facilitators. She does all the training, and with using the Likert scale and just asking how you felt before attending a session and after. And like I've shared with groups, I was just hoping that the biggest complaints we've had is that we don't have a good variety of tea and that the rooms are too cold. So I was hoping on this Likert scale that neither of those people would say that they were somewhat worse because, and that we used plastic water bottles was another complaint. So I think for the most part, people are feeling better after the series, but because most of what we've heard has been very, very positive, like I said. Next slide, please. So our next series will be at Shepherd of the Valley Church. So again, a very different location. It's going to be on Thursdays and not Tuesdays because that is what worked for the church. We have registration starts at 6. This isn't there are marketing materials too that will be put in the chat. That will be the full page flyer and a trifold brochure. This is just kind of our little almost save the date. So how the evening, 6 o'clock is usually 5:45. We have coffee on. People come and, especially after the first night, come and start to socialize about 5:45. 6 o'clock is registration where you would fill out your card. And then 6:30, the speaker starts. The speaker goes from 6:30 to 7:15. And then we take a little break, 7:15 to 7:30. And then the groups are 7:30 to 8:30. If you are a facilitator, we do a debrief after. So just to go through anything that might have come up. We've had a few interesting things, a few people that maybe are too new in their loss and couldn't stay in a group. So we have some wanderers sometimes. We've had a couple people that were just released from substance abuse counseling or treatment. And so we've had a few of that. You're going to get, when you invite the community in, a few things. And so that's why we like to debrief, just to talk about those things, talk about what we can do for the remainder of the series and then just for the future too. But I will say overall, the most rewarding part is that last session, because people do not want this to end. We get asked this all the time. Can't you just do back-to-back sessions? Because I would love to keep this going. We highly encourage groups. They form, they bond. If they want to share phone numbers and emails and form their own group, we encourage that, but we do not take responsibility for that. And we always tell them we have our next series, 5 months down the road. But that last night, it's just, you really can see the difference, that there is some hope brought, and that this really did help those who came to it. So I think that's my last slide. If I would love to take any questions. Oh, so the leadership team. So as you see, that's Dr. Nato, founder. I am a co-founder with Dr. Nato, and then I am the current director. We have program leads, so Catherine Morin and Lisa Sheeman, and then we do have an admin. So none of these positions are paid other than the admin. We do pay him a stipend because it's just a lot of work and a lot of copies. And he's been hosting meetings as well. And something I'd like to clarify, you probably kind of see Lakeview a lot on here, or Health Partners. This is not a Lakeview Health Partners community health funded organization. It is totally community. However, I don't know that we'd be here without Lakeview Community Health Foundation, just because they gave me hours out of my day to dedicate to this work. Catherine Morin gets, I think, 2 hours a week, something like that. And the Hudson Foundation is paying for that. So we've found interesting ways, because this is such an important community initiative, and because the hospital benefits, right? So when they have the chaplains are dealing with families that are dealing with death or chronic conditions, there is a place to refer these families and individuals to that wasn't there before. So just want to make that distinction, that we're very heavily supported by them, but we are not Health Partners or Lakeview Initiative. So questions? I think I covered everything, but you never quite know, right? I think somebody has their hand up. Just feel free to speak, because I don't know how to call on you.
Thank you. This is
Yes.
Andrea Martinez with Health Fairview. Thank you for sharing the information. This is great. I do have a couple of questions. One is about capacity, how it's looking like for you guys. Like, do you have a limit of folks who can attend a session? Do you have a wait list? Just wondering how, and if you have seen that evolve as you've done more outreach about the program. I did have another question, but I'm blanking. So perhaps
I'll answer that one and you can think. So we
Yes.
don't. I mean, what we tell our churches, or if we go out of churches and go to a community center, basically we concede about 200 in the presentation. That's what we want. And like I said, with the 168 total served, we usually have about 100 a night. And so that 200 for the presentation. Now, could 400 people show up? They could. But I guess deal with it at that point, but that's what we try to plan for 200 people. And then we've had 15 breakout groups at both sessions. So that is 15 groups. And some have been filled to capacity, but for the most part, we try to stay within like 7 to 10 people per group, or it gets too big. And with the spousal group, I will say we usually have 4 to 5 spouse groups. That is by far our biggest group. So we have about, I think last series, about 60. So we had 5 groups and everybody didn't show up every night. So it was about 9 to 10 in each group. So no, we have not. And I don't know if we'll run into that problem once, this is only our 3rd series, or if it will just kind of be that based on location, you're getting different pockets of people, So I hope that does not happen, because you can't grow too big, right? You want that sweet spot. And I think we definitely have room to grow right now. But not, So that's
Awesome.
a good question. Yeah.
I remember it now. My other question was about the facilitators and what kind of training or prep did they get?
Yeah, so we ask for facilitators. Dr. Nato then kind of, if we don't know them, a lot of times we know them. So we know Dr. Bransford. He was a doctor at Lakeview for 40 years. We know he's qualified. His wife is a psychiatrist. We know she's qualified. So if we know people, we know their credentials. We got probably a list of 20 of people we just knew within the community. Now we've been getting more people that call and say, I'd like to be a facilitator. So we actually had to come up with a process, because we're like, oh, we don't know everybody anymore, which is great. And so Dr. Nato, being that she is, a doctor, a psychologist, a nurse, all those things, she screens them. And so she just has a phone call with them and asks, what's your background? What groups have you led? Have you led grief groups? Looks at their credentials and then kind of says, yeah, we'd love you to come and facilitate, or maybe could you just come to this series and be part of a group? Because a lot of times that what will happen too is somebody is part of a group as a participant, and the next time they say, I would love to facilitate with somebody. You know what I mean? I can do that. And so we kind of get people 2 ways. One, just people saying they want to facilitate, and one, I've been through your series and now I'd like to facilitate. And so Dr. Nato really screens those people. And then we have a facilitator form that they fill out what groups they are comfortable and have led, what groups they would not feel comfortable leading. And then we do a 2.5-hour training. So we just had that training last Thursday, and we go through confidentiality, those things that everybody should know, but you have to say it, right? You have to know that they know that what stays in group, is shared in group, stays in group, all those things. And so, it's in 2.5 hours, you're not going to learn to become a facilitator. You have to have some qualifications before, but it's worked out really, really well. And if we're ever hesitant, we pair them. And then that way you have feedback from a very experienced facilitator saying, hey, I don't know that I'd give them a group on their own next time, but definitely great facilitator. So, yeah. And what I love is I've seen a lot of retired people come in and say, wow, I never thought I could be retired pastors, retired nurses that did this, and just are like, oh, this is, and they love it. I have not had a facilitator that has not either come back or just said that was just the best experience. So that's been good too. Anybody else? Well, I thank you. I thank you for, and Kathy, do you have and Mary those in the chat? I didn't go in there yet. Sorry, I guess I should check. But there is a flyer, and then, like I said, a trifold brochure. You can print those. And the other thing is if you don't have a color copier or you don't have a budget to print those, we do have copies at Simonet Funeral Home in Stillwater. Otherwise, I'm happy to work with you to get you, if you want to pass them out somewhere. We usually have a stack at Simonet Funeral Home just because that's where our admin person works. And so it's kind of a central location to pick, because I know not everybody has the budget or a color copier to make copies, but we very much appreciate, your neighbor. Think about your neighbor who's had a loss, or bulletin boards that you can put up. That's how we get people. That really is how we get people. So it's word of mouth. I mean, it's meetings like this too, but it's then, I think, making that personal invitation to your neighbor that maybe lost, their spouse in the last 6 months. Oh, that's a good thing. And that's I saw that question. We definitely say it's for adults, and we're trying to come up with wording, because we know that every 18-year-old is not the same maturity level. Definitely not for children. And the reason for that, and again, that's because of Dr. Nato's expertise and just working with groups for 40 years. She really feels like once you bring somebody under 18 into a group, that group instantly protects the younger child and does not share. And so they definitely don't want it for group dynamics. And then the other piece is that some of these groups can get very, very heavy, as I mentioned, very heavy. And they just don't think it's appropriate for children, not knowing their maturity level. So something that's been brought up, definitely a need. But at this time, we are not qualified to provide this to kids. So I don't know what we do if a 19-year-old showed up. We'd probably talk to them and say, this is how the groups are run. We've just said adults, and we have not defined what an adult is. And I just want to briefly say too, so when I said Minnesota-Wisconsin initiative, this definitely is a Minnesota-Wisconsin initiative. Part of having our next series at Shepherd of the Valley, we are really hoping people from across the river will come across the river and attend. I think we had 12 participants the first time and 15 or 16 the second series from Wisconsin. We would love to see that number go up. We eventually would love to have another grief coalition in Wisconsin to serve New Richmond, Hudson, Amory, and then just, of course, all the areas in between. But right now I can't think about that, but that is something we would like to do. But just know that for Wisconsin too, we might have transportation set up for Wisconsin as well as Minnesota this time. I do have a driver for Minnesota. Wisconsin, I'm still working on a bus out of Bethel. So just know to share these with Wisconsin. We're really trying to target Wisconsin, especially this series.
Jen, I did put the link to your
Okay.
website in there, and also the 2 flyers were included in the February Connect notice.
Okay.
So if anybody wants
Perfect.
those, you can send me an email and I can send them to you.
Perfect. Thank you so much. And thank you for having me. This is always a really good time to have them, because the series is starting next Thursday. So it's not that you forget about it when it's not, but it's nice that it's right around the corner. So, and Shepherd of the Valley, I don't know if anybody has been there. It's just a beautiful community space. It really is. It doesn't feel super churchy. I mean, we try to get that look more like a community space, that have the coffee bars, that have the, it's a very welcoming space, I think, to anybody. I hope so. So thank you. And feel free to email me anytime. And yeah.
Jen, you said you're primarily in the Valley. What if you know people, and I saw on your slide that people come from all over, like Dakota County, Chisago. What if is it okay for us to be promoting this I live in Dakota County, so I'm like,
Yeah.
I'm thinking of people right away.
Yep, absolutely. With the transportation, and we try to say we provide transportation. We've also said we're going to have to set a limit to that, obviously, because it I have the lady that's driving is probably 70 years old, and I mean she's perfectly fine to drive, but she can only pick up 3 people or whatever. And doesn't want to go super far. But what we just, I'd encourage people to tell us. A lot of times we'll have facilitators. We have 2 facilitators from Roseville this time, 2 from Burnsville. So you never know who might be coming. And I do ask people that. The other thing is we've just talked about getting vouchers for Uber. If we really need, if somebody really cannot get there and cannot afford it, we're not opposed to doing that. So yes, absolutely. The 2 facilitators from Roseville, in fact, work at the Preserve Assisted Living. And so I just emailed them this morning, like, I think you should get a bus and have all the people from the Preserve of Roseville come to I know it gets a little late, but that's for our facilitators because most of them have full-time jobs. So gives them time to at least have dinner. But yeah, absolutely anybody. And like I said, the biggest part with that is that if they have specific needs, we'll work with them.
And you brought up people handed you checks at this first meeting and you didn't know what to do with it. What if someone wants to make a donation?
So on the website, you can make a donation, and that's where it gets a little bit confusing sometimes for people. So because we're not a 503, whatever that is, we're not a true nonprofit. We have the Lakeview Foundation is our fiscal sponsor. So that's how we get around being a nonprofit right now. And we might be but we grew too fast. We wanted to have our first series. So all the donations are made to Lakeview Foundation, but they go in a completely separate fund. But you do get a thank you from Lakeview Foundation with my signature on it, and it is tax deductible. So that's the nice part about that. And then I am also treasurer, and with oversight of our steering committee and others, that's how we take donations. But they're made out to Lakeview Health Foundation, even though it's really not Lakeview Health Foundation, it's the St. Croix Valley Grief Coalition. But yeah.
Beautiful. Thank you.
Yes.
Did that give people time for any other questions? I mean, we have the expert on the call, so it'd be great if you have something bubbling up and you're like, I'm wondering. Okay. Scrolling through chat too to make sure we didn't miss anybody's question.
Yes, me too.
Thank you. Great. Well, thank you. Oh, somebody just popped in. Yeah,
That's me. Nope, that's me. So you can go on.
Okay. Well, thank you, Jen.
Yes.
Also, wishing you good care for yourself. This is important and heart work. So
yes, it is. Yes. Thank you.
And the team and all of that as well. You're welcome to hang out with us because now I'm going to send this over to Dan Parnell we're going to try and do like agency updates, and we'll do a spotlight, and we're going to have NAMI Washington County as our spotlight today. And Dan, if you would share a little, that'd be great. Oh, you're on mute, my friend.
Yep, I thought, and my picture went away. I thought I was turning myself on. I was turning myself off. NAMI, Washington County is where I do a lot of my day, and I lead a small group of volunteers who are kind of an offshoot of a national organization called the National Alliance on Mental Illness. That's NAMI, the acronym. And just to give you a little background about what that is, there is a national office of NAMI, and they manage kind of the oversight and the federal policy involvement. They have an office in Alexandria, Virginia, just across the river. They do all of the branding, so anything you see that's NAMI always looks the same colors and the same design, that kind of thing. They have, I think it's probably something on the order of 48 or 49 states that have state organizations as well. NAMI Minnesota is the parent for us, and they are very strong. They're really well noted for their involvement in state policy, and Sue Abderholden is the leader of our Minnesota faction. I'm sure everybody is familiar with Sue from either seeing her on the news or hearing about her from her involvement in different programs that are going on. There are about 15 different organizations like ours in the state. Many of them, especially in the metro area, are to the state boundaries. Some of them cover multiple states or multiple counties. But the idea of the county is that it's the local organization for where money would pass through, where particular laws are enacted, and that kind of thing. In each case, at the national level, at the state level, and at the local level, what we're all about is the same things Jen mentioned. Our organization exists for advocacy, support, and education. So we're not like a traditional service provider. What we are is a nonprofit really designed to help families, people who live with illness, and their families primarily. Here in Washington County, we've been involved with every aspect of that. The work that we do, like this, like our involvement in the local advisory committee, like other advocacy that we've done for some of the crisis services, for example, is all around kind of taking care of crisis. We're noted in the state. I think we probably have the most support groups that are available to any local, what do you call it, affiliate, which is what we call our chapters. And we have four of them. So two of them operate in person, and they're primarily for adults, for families of adults who have mental illness. We have started, and I would note that it is at the same place that the spring grief sessions are going to be at, a new support group for parents of children. And I really want to try and promote that because that's something we haven't had in the area for a long while, and it's needed. The other one that we have is one that is done on an online tool that's like Zoom. And on those, it's really kind of because of the nature of how that it's promoted. It's available for anyone to come to. And we began doing the online support groups when the pandemic came around, and realized that we were supporting people from across the state who didn't have even one that they could have gone to before the pandemic began in person. So we've continued it since then. And as a result of the way it's promoted now, we've had people from probably something like 20 states join our support group, and about 4 or 5 countries. So we've had people from Japan, South Africa. It's incredible the reach, but with mental illness, it really knows no boundaries. So we're able to provide that. In education, primarily, we've been involved with doing things like helping with the CIT training that happens. We use the arm of NAMI Minnesota to do classes where they have some state people who come out and help us in education. Janelle Olson, who's also on this call, give a shout out to Janelle there, is an educator from way back, and she has done a number of classes related to kind of hope for recovery that tells the basics of mental illness and things like that. And again, to talk about our advocacy and the way we do kind of the support pieces that we have. Jen Agen and Janelle are familiar with each other by virtue of the fact that Janelle is our outreach coordinator to the faith community. And we've done some work to kind of be in a position to give the faith community in Washington County information about things that we have going on. We had been involved quite heavily in advocacy for crisis services. And what we've seen is that the county has really responded, and there are a number of ways in which they have improved the response that we have to mental illness crises. So Sam Axt is on here, and she leads that crisis response group. They're doing great work. We have had good support from the sheriff. They've developed some co-response units. There are now 6 of them operating in the county, and including 3 therapy dogs that go out. They have done great work. There are social workers who work in the jail now and help with making sure that people who are jailed and have mental illnesses are supported, are connected to services, that kind of thing. So in the next year now, we're going to turn our attention toward doing things that would relate to young families, youth. We're going to try and go to the other end of the spectrum in terms of trying to find ways that we can delay, support earlier, that kind of thing, people as they have issues with anxiety and depression, things like that. So that's about it for the introduction to NAMI here in the county. Any quick questions or anything on that? There's so many of you that I've already worked with in various ways. So and plan to. We've got some hope to work with the Stillwater area community services. And I saw the representative from her on here. Shoot, I'm looking at a parade of faces and things, and hard to respond. One of the things that I do in terms of the what do you call it, the advocacy, is every year I go down to the Capitol for Mental Health Day on the Hill, and I did want to highlight that a little bit too. That occurred last Thursday. And it's put on every year as a way to bring attention to the state response to mental illness. And it's organized by something that's called the Mental Health Legislative Network. It goes by the acronym then MHLN. And if you look at, if you go to Google and do 2025 MHLN, you will see kind of like the description of what the priorities that are listed for the legislative session this year was. On those days, they have a policy briefing, and this year it occurred at the Armory just a block away from the Capitol. There was a full house of the Armory floor. Chairs were all filled, and there were people standing around in back. And then they were given kind of a description of the different things that that legislative network has agreed that are areas of either support in terms of money or funding, or like bills that they would want to have to change policy. And I would characterize this year as kind of a down year. because there's the recognition that there's a deficit from some previous year's allocations, and the legislators are in no mood to spend heavily. So that kind of flavored things. The other thing that happened this year is that there is very tight and somewhat dysfunctional legislative things going on this year. The Minnesota Senate was kind of tied in terms of membership from the Democrats and the Republicans until an election just recently to fill the seat of one of the members who had died. So the Democrats hold a slim majority of 34-33. And so as a result, any of the things that are passed are going to be kind of centrist in terms of whatever the preferences are from both sides of the aisle. In the Minnesota House, it was the again it's tied in terms of the number of legislators from each side, but because of disagreements about how you would seat certain people, they didn't even begin to have the sessions until a couple of weeks ago, and they had to work out arrangements for who would actually become the Speaker of the House. So that kind of all flavored the way the thing went. I had a chance to talk to my senator and advocate for some of the things that I know that are both probably in our interest, serving the mental health community, and things that might garner her support. I also talked to Peter Fisher, who sits on the House Health and Human Services Committee and Policy, or Human Services Finance and Policy Committee. And he made it sound as if there are a lot of things that they are working on that have mutual interest for both sides. So even though the session was only 2 weeks along, he feels like there are going to be some things that they can move on. Probably the greatest issue that we face is from the federal level, and that has to do with funding that happens primarily for services that are there from Medicaid. And even this morning, I had talked to Mary briefly before we began, and there's some news from there that I'm not even aware of. But that kind of gives you a sense for what's going on in the kind of as a legislative update. Perhaps after the session is over later in the year, I can come back and kind of give you an update on what things actually passed, or where funding is going to be a problem, or that kind of thing. Let me finish with this. The leaders of that mental health legislative network are Sue Abderholden from NAMI and Shanna Mulvihill, who leads Mental Health Minnesota. And they recently sent a letter out pleading for the money, that the rates that are used for Medicaid reimbursement to improve. Right now, what we're seeing is that a number of providers can no longer afford to do the work because the money that they'll get for providing those services doesn't make it worth doing. And that's a problem, because that means those services go ungiven. That means those people go untreated. So, Mary, is that sufficient?
Dan, that's wonderful info. Can I ask if anyone has any questions of you that would be a good
Sounds
time?
good.
Dan, I have a question. I was wondering if you could talk more about the support group for parents with kids with mental illness that's coming up.
Yeah, they meet on the second Thursday, and in fact, they're going to be in conflict with Jen's group out there. So I'm hoping that we'll be able to put up a sign to let people know that we're there when they conclude with their programs later. But it is led by two facilitators. both who have young people, their son and daughter, who live with illness. And so they have been trained by NAMI to do the facilitation. We operate under a set of very strict kind of process model to make sure that we account for it not becoming a whining session, but more a working on skills development, working on the issues that you hope to use, and a real sharing of parents, and caregivers, stories of what things worked for them in certain cases or that as avenues to try something different when you're having a problem. Those sessions last an hour and a half, and it's open to anyone. So we often have people come from across the border in Wisconsin to come to our support groups, just because there are fewer of them over in Wisconsin. Right off the freeway, so it's easy to find.
Dan, is it for parents of a certain age, children, or?
We don't put any age designation on it, but there have been, cases where parents have come at the first sign of recognizing something is wrong, at 10 or 8 or that kind of thing. It tends to be people who are, parents or caregivers who are parents of someone who is in a teenage situation where they're either having issues in their high school life or moving through transitional age where they're becoming an adult, but they're not showing that they can handle adult things. It really, I think people just, whoever feels comfortable being there, and what they get out of it kind of drives how many are there.
So someone put in the chat, can you send us a link for this group? I have your NAMI Washington County affiliate page up.
Yeah,
I dropped it in the chat. Which
perfect.
one is it? Because I see a family support group at the River Falls Library. I see one at a in-person peer one. Yeah, family support Tuesdays in Oakdale.
It is neither of those, is not one of those, and I'm concerned that maybe it's not updated.
Okay, just yeah,
But I can send that out.
that'd be great. And then maybe Kathy, if you can add that to the info, that'd be awesome. Any other questions for Dan, friends? And I think Jen is still here, so if you had a question that you're like, oh, maybe I still can ask Jen a question. Quiet group. So thanks, everyone. What I'd love to do is we have some voices on the call that might be new to everyone. And this is that opportunity where we get to have everybody share. So along with what you did already in the chat, I think it'd be great for everyone to go around and who you are, your agency, any updates that you think we all would benefit from learning, or any updates. But I think we have time to have everyone. We used to do this when we were in person and we would just go person to person to person. And I think we can still do that in our virtual setting. So I would love for everyone who, and what do you think is easiest? Should I just call on folks and then we'll just rotate? I mean, I have the attendees, participants open, and I'll just float on the line, if that works for everybody. Cool. So Dan Porter is my first name that is on my Dan, could you introduce yourself and any updates for us, please?
Hello, Dan Porter with Northeast Metro 916 Intermediate School District. I don't have any updates.
No worries. Good to see you.
Right. Yeah, good to see you too.
Alana, can you do any introduce yourself and any updates you have, my dear?
Yeah. So not a whole lot going on for abuse responsive prevention services, and I'm the supervisor there at Canvas Health. And so, hi, all of you. Kind of busy time, but it's not as busy as like spring or summer per se. And so we're just kind of preparing for the inevitable busy time coming up and thinking of things we can do for Sexual Assault Awareness Month in April.
Thank you. Kathy Makowitz, you got any updates for us?
Sure. I'm going to put two things in the chat. One is, so I put the meeting link in there. Sometimes it's missed in the announcement. So if you want to create your own calendar, whatever, calendar hold for the meeting, that would be great. It's the same link for the whole year that Mary so graciously provides for us. Also, there's a change in any announcements or trainings. If you could send it, there's a new email there. It's the PHE@COO Washington MNUS. So PHE stands for Public Health and Environment. And then that will get to me, and the deadline is 4 p.m. on the second Monday of the month. And so things that you see attached to the monthly email are things that folks send to me. So if you could start using that, that would be great. I think that's it.
Perfect. Chelsea, you could introduce yourself and any updates?
Yeah, hi, I am Chelsea Flores. I am a fire captain paramedic and a community paramedic with Cottage Grove Fire Department. So I got connected to this group recently. So this is my first time attending. So we are working on our community paramedic side of things and just kind of creating a more robust program here. So I'm part of a CMU team, which also includes police and an embedded social worker. So we basically, what I do is I follow up after 911 calls for people that need more resources or need help with like medication management, mental health. We do all sorts of things, including fire-based assistance, safety fall prevention. We are currently working on a new program called the Public Health and Safety for this one specifically is for older adults. It's a program where we will be able to kind of tailor it to whoever we would like to teach it to. So it's going to include fire, police, and then also a member of the Washington County healthcare workers. So we can reach, currently we're going to pilot it with older adults, but we're hoping to do one for like newcomers too as well in our community. I think that's a big one we need to do is educate the newcomers about things in Minnesota that they may not know about. So we're really excited about this program. So just know that we're here. And if you have any questions or anything, I'll just put my email in the chat below and reach out to me. I'd love to learn more about this stuff. So thank you so much for having me.
Wonderful to meet you. I look forward to further connections. Glad you were able to join us. Cindy Parsons, can you jump in and introduce yourself and updates?
Hi, everyone. Cindy Parsons with the Connect Center. We do serve all of Washington County. We have offices in Cottage Grove and Stillwater and now St. Paul Park as well at the Basic Needs office there. So we do serve really youth with unstable housing. We serve low-income families. We also serve older people and singles that are needing housing with our AmeriCorps housing resource navigators. We have opened our drop-in center for youth with unstable housing in Stillwater. It's every Wednesday from 3 to 5. But we do have both our drop-ins, both in Cottage Grove and Stillwater, available for appointments as well.
Good to see you. Next, I have Janelle. Janelle, do you have any updates? And please introduce yourself.
Okay, I'm unmuted now. Just want to thank Dan for the background there on NAMI in Washington County, and I am really happy to be part of that, and that's who I am.
You do great stuff, so thanks for being that link for all of us too. Jennifer, could you jump in and share a little of you and any updates?
Yeah, so I'm Jennifer Andrus with Stillwater Community Education, and I do programming for adults with disabilities, youth, and families. And one thing I wanted to share with you all is we are doing for May, we're planning for May's mental health awareness. We have a lot of things we're offering in April and May, including some book studies on the anxious generation. We are partnering with health partners to do Make It Okay, Community Thread, libraries, Family Means, NAMI. And so I'm going to put in the chat a link for our new catalog. Registration opens March 3rd. So next week, and a lot of the things are free. We're seeking funding right now, but we're pretty optimistic that will happen. So we wanted to offer things for no cost. So we would encourage you all. We also have a flyer, which I think is going to be sent to you, Kathy. Someone was going to, I met with, I think it was Ann Rooney. Does that sound right? Yep, Ann Rooney. And she was going to send it to Kathy, which is like a two-sided flyer that has all of the mental health offerings. So if people would want to put that in their programs or send it out to people, they could do that as well. But I'm going to put the catalog link in right now. That's broader, but then the mental health one, we can get that to people as well. So thank you.
Jennifer, there you are.
Yes.
I'm hoping to be working with you in Mental Health Month.
Yes, we have 4 presentations with NAMI, so we're very excited. So thank you for those connections.
I should just wanted to add one more thing. If you do send me anything for the monthly announcement, if you could write a couple of sentences that I can just easily cut and paste versus don't just send me a flyer, but like, here's this, here's the date, here's what we're doing, who to contact, just so that I don't have to get creative with that. That would be great.
Absolutely. Thank you.
Thanks for that reminder, Kathy. Justin, could you please jump in and introduce yourself and a little bit about your services that were?
Yeah, thanks for having me first visit. This is a great group. Justin Grossner, a child psychiatrist, and part of just opening Vantage Mental Health, which is an outpatient clinic for psychiatry and therapy in Stillwater and also virtual. We're right at the end of 36 behind that Carboni strip mall in the old bank building. We've got a great group of therapists and psychiatry services, seeing children and adults, take all major insurances, including Medicaid and Medicare, and really just excited to kind of meet the community needs. We've just opened in the fall and then have onboarded a few new people. So we've got great availability, online scheduling, really just trying to kind of make it easy for people to get what they need when they need it, and happy to connect with everybody here. This is great.
Just in the audience that you serve, maybe somebody and it flew past me.
Sorry, what was that?
Age of clients that you all serve.
Yeah, so I'm a child, adolescent, and adult psychiatrist, and we've got a physician assistant who sees adults. So on the psychiatry side, pretty much everybody, and then the same thing on therapy. So we see kids, the MAC's down to like 6, so 6 and up. And then we've got a couple that specialize in aging too. So
thank you. Great to have you. Wonderful that you're here. Next one would be Carrie. Please, love to see you and any updates. Introduce yourself.
Hi, good morning, everybody. I'm Kari Caldwell, and I'm the positive. Oh, that's okay. It's a Scandinavian name. Kari Caldwell, and I'm the grant coordinator for the Positive Community Norms grant in Forest Lake area schools. So working with middle school, high schoolers, prevention, substance use prevention work. And I just want to say this, I've been in this role for about a year. It is a 5-year grant. We're in year 4 of it. And really, it's creating healthy communities for our kids to thrive in, for our parents to have support, creating a healthier community. And, I keep coming to these meetings keep learning things each time I attend, going, I have lived in Washington County for like 20 years. I never knew all of this. So just so helpful to have these opportunities to hear all the variety of things that can help our kids, help our families, just to grow and thrive. So great to see everybody.
Thanks, I'm sorry. That's why I said it so slow. I'm like, is it Carrie or Carrie? So forgive me. Thanks.
All good.
Kathy Walsh.
I couldn't find my cursor. Anyways, sorry. Kathy Walsh, juvenile probation for Washington County. I have clients from Forest Lake down to Cottage Grove. All of this information super relevant today, so thank you so much. And I don't really have any updates, but thank you.
Great to see you though. Katie Pape.
Morning, everyone. Good to be here with all of you. Katie Pape. I work with all of our childhood and family programs at Canvas Health. No big announcements, just that we are open to therapy, referrals, child aid treatment, adult aid treatment, all of those kind of services. So have a great day.
Good to see you. Thanks. Christina is next on my list.
Good morning. I'm Christina King, and I work at Stillwater High School, and I serve students 9th through 12th grade. And we are about a month into second semester, and we're just wrapping up registration for next fall. We had Blast Week last week, which is kind of a week-long celebration of diversity and just kind of different speakers and dress-up days and cultural awareness. Was last week around Valentine's. And I don't really have any other updates.
Super great that you're here. Thanks. Lauren.
Hi, everybody. My name is Lauren Urchel McCabe, and I do outreach for EOSIS, formerly known as Meridian Behavioral Health. We're a co-occurring substance use disorder mental health care in residential, outpatient, and detox settings for adults. Our big update is obviously the name change. We are fully rebranded. I know that a lot of you folks and your organizations have referred to us before under the name Meridian. We are now EOSIS to keep up with our changes in patient care, as well as the acquisition of the gateway detoxes and stuff like that. We wanted to have a new face, new logo, everything like that. So I put our website in the chat, and then my contact information is up towards the top.
Wonderful to have you. Thanks for being here. Leanne, could you come on next?
Yeah. Hi, I'm Leanne. I'm with Ounce of Care. I was in this meeting like over a year ago, but I'm with Ounce of Care. I am a community navigator for a low-income building right in Stillwater. Right now I'm serving older adults and individuals with disabilities. So I'll meet one-on-one with them. All services are free to residents. I'll meet one-on-one with them to help navigate any formal or informal services. And then another part of my job is also throwing events for the residents. So I try to do a mix of fun social events and then other wellness, educational, health events.
Great to have you. Glad you're here. Lily, can you jump in, dear?
Hey everybody, my camera is still not working this month. Apologies for that. So my name's Lily. I work with Prairie Care as a community relations coordinator. We have 9 locations in Minnesota, 1 in Woodbury. We also have one up in Maplewood, so not too far. An update, we have immediate availability at our Woodbury location. So if any of you have any adult clients or patients that you're working with that need a higher level of care for partial hospitalization, intensive outpatient, what have you, we do have immediate availability in essentially all of our programs there. So, if you have any of those, we have a form on our website that you can fill out, or they can just call us directly and kind of get the ball rolling. But yeah, thanks for having me.
Thanks. I'd like to say good to see you, but I can't see you. I'm being silly. Lori, would you jump in next?
Yes, hello. I am Lori Schmidt with Anoka County Community Action Program. And even though it says Anoka County, we do cover early learning scholarships and Head Start in Washington County. Our Head Start sites there are Forest Lake, Newport, and Oakdale. And right now, Head Start does have openings, so they are working on enrolling more children. Oh, I should have said to begin with, so Christina Schweistal is usually here for Head Start, and she just had a baby boy this month, little Theo. He's adorable. So that's why she couldn't be here. With early learning scholarships, they could actually cover tuition outside of Head Start days and hours. There are new allowances for ages birth to 5 years, and they've also increased the income guidelines so that they match child care assistance. The award amounts now have also been increased, and that's based on the child's age, the program they're attending, and their home area. And we have a kind of a new online application. It started back in July. That's available, and it's working really well. So we're directing families to apply that way, but we still do have paper applications. And so last year we received tons of funding. This year, of course, that was cut. So we do have a big waiting list. It's kind of sad, but we still recommend that families apply and get on the wait list. And either of those two programs, families can check out our website at acap.org for more information.
Thank
Thanks.
you. Congrats to your coworker as well. Would you drop your
Yeah.
website in the chat so people?
Oh, sure. Yes.
That'd be great. It's just then it's all in one place. Thanks, Lori. So glad you can join us.
Yeah.
Esther, do you want to go outside?
Lisa,
Esther.
I see you on the call, but do you have any updates, dear?
Hi, good morning, everyone. Lisa Wong with Washington County Public Health and Environment. I think just a couple updates. We're working on some of our trauma-informed care training, so we're going to begin offering that to different organizations. And then also we are planning for May's Mental Health Month as well. And so we are working with our parks in including a little bit more nature into care. So we'll be offering to providers an opportunity to get some CEUs and incorporate nature into some of their practices. So yeah, just a couple of things coming up, and thanks for having me.
Great updates. Thank you, dear. Lynn, would you jump in and introduce yourself and share any updates?
Sure. Good morning. I'm Lynn Price, and I am a County Community Liaison from Blue Cross. And I am here this morning for my partner, Fuachua, who is normally the liaison assigned for Washington County. She recently had a baby boy last month, and so I will be covering for her over the next few months. So nice to be joining.
Thanks, Lynn. Good to see you, and congrats to Fua. Marta, do you have any updates for us?
I don't know if I have any exciting updates, but I'm Marta Wilson, and I'm the clinical supervisor for school-based therapists and therapy at Family Means. We're a community agency in Stillwater. And we are in all the District 834 Stillwater schools and some of the 622 schools, and our therapists are full. Even our interns, full, which is good. We want to get the access for that. We're also, I guess the only update that I have is we're midway through a really extensive and valuable training, trauma focused CBT, which we're also doing in a cohort with Canvas Health and some of the 622 therapists. So seeing more and more trauma and families struggling, and with a lot of the climate going on right now, and I don't mean the greenhouse effect, but there's a lot of existential and very real another systemic overlay of those things that we see are affecting the students, the young people, and the families that we serve. So
Marta, can I get an acronym check for CDT for us lay people?
Oh, sure. Yeah. Trauma-focused cognitive behavioral therapy. And what it is using cognitive behavioral therapy, which is a lot about thoughts, thinking, changing behaviors and emotions and the links between those. And this is a lot of helping people sort of break down traumatic experiences that may be really deeply located in them, in their body and their mind and their emotions, and sort of a very systematic delivery of skills and things that help them process this so it's not still affecting them. More than you wanted to know. But yeah, that's what we're doing. And yeah, and then just seeing the kids, seeing the families. So, and I just want to shout out to Justin Gerstner. We're so excited to have him in the community. Knew him from Prairie Care a little bit, and I think that's going to be a really great resource for us because we have a hard time finding psychiatry sometimes for kids in particular. So
thank you. Really nice. Next one I have down is Randy. Could you introduce yourself, and good to see you?
Hi, Mary. How are you? Good to see you guys. Randy Backus with Be Extraordinary BU. So we are educators. We get out and speak to schools, kids, professionals, kind of about the damaging and detrimental effects of today's marijuana, specifically THC. So there's a lot of misinformation about it, and it's really letting the kids know, hey, this stuff can really change your outcome, and it's not for the better. So we get out to schools. A lot of the schools we get out to are in the outstate area, to be honest with you. People will bring us out. We'll go to 4 or 5 schools. And it's hard to get into the ones around here in the cities. And I don't know if it's because people are afraid to admit that there could be a problem, but the fact of the matter is this stuff's rampant anyways. But we did get into White Bear Lake last week, so we spoke to about 550 to 600 ninth graders. So that was kind of a big thing for us. It was exciting. We've done a lot of private schools, but anyways, if you have anyone you know that is looking for people to come in and do an hour presentation, that's what we do. And it's our hobby. It's our passion. So it's not our full-time gig. So thank you, Mary.
Thank you. Glad you're here. Samantha, can you introduce yourself and any updates?
Hey everybody, Samantha Axt. I am one of the supervisors for the Washington County Crisis Response Unit. Hello. It has been a very busy month for crisis response. We are hiring right now and kind of transitioning a lot of things because crisis stabilization is growing. So my role is actually even transitioning a little bit too. I will crisis response mostly is with my co-supervisor, Beth Reitzel. She usually works in the more evening time frame or comes in the afternoon. And we're hiring for a new social service supervisor who's going to come on during the daytime and really work with our data analysis because we are growing so much, and a little bit of scheduling and some of the communication needs, working with our outreach team. Because another part of Washington County, at least in our adult services, is we have an outreach van that is starting to go out into the community. I'm just crisis is always a part of it, but I'm not the one in charge of it, if that makes sense. So I don't know a whole lot of details with it. But that means my role is transitioning to really lead the crisis stabilization, as well as I'm going to be adding in some forensic case management services, because that's also a heavy growing need for especially our Cottage Grove and Woodbury populations. And then with the stabilization side, I'm listening to all the school connections because that's kind of a big personal goal of mine, is over this next year or two to really connect a lot more with our schools, because crisis stabilization is such a great need besides the one and done that a crisis response service can do. We also have a peer mentor already on our staff. And we're actually looking for a second peer mentor, and we hire through Radius. So if anybody's interested in the peer mentor, but also they meet the qualifications as a mental health practitioner, that's what we're looking for. So we know it's a hard sell. There isn't very many people who qualify for both, but we do support that process and are really trying to grow that. Again, they work primarily in the crisis stabilization team, but can be referred directly from our crisis response for a specialized meeting if they need that family partner, peer mentor approach. So we have a lot of stuff that's kind of I don't know, coming up in the sense, but our staff are just busy. It's, I don't know, it sounds like a lot of you guys are kind of dealing with that too. Kids are back in school. Spring is around the corner. We all know we're in Minnesota fall spring right now. We know it'll get cold again, but please just send everybody our way. I mean, please share the crisis information. Our staff are very willing and wanting to help. We get a lot of housing and a lot of financial calls, and we try to direct those people to the right resources because we really want to hone in and specialize on our actual mental health crisis needs. So I put my contact info out there. Mary knows my contact info. So if anybody has further questions, I am around.
Thanks for everything, Sam. Sonia, and guys, we have 3 minutes. So I'm sorry to make the last couple here go quicker, but Sonia, could you jump in and share a little
Sure.
update?
I'm Sonia from the Minnesota Alliance on Problem Gambling. We do have a job posting available right now for program manager. I will put the link in the chat. It's our LinkedIn, and according to LinkedIn, we're no longer accepting applications, but we are accepting applications. So you can message our boss, Susan Sheridan Tucker, about that. We are always available for presentations. I will echo what Randy said. It is impossible to get into metro schools. We are presenting in Rochester this week, which is great. So we are available for presentations to schools, to older adults, to parents, really anybody. We also have free, that's always free. We also have free resources, brochures available for all ages. And we do have some that are translated. So please contact me. Thank you.
Steph K and then Steph L, but let's start with Stephanie.
Hey everyone, I know we're very short on time. I have just one thing I wanted to get out to everybody. Our Health Partners Programs for Change, which is our substance use disorder outpatient treatment in the St. Croix Valley, is partnering with Hazelton Betty Ford Foundation for a community event coming up on March 13th at the FIPS in Hudson, and I'll send the flyer. And it is really a time to get together and talk about what recovery looks like. It's overcoming barriers and reducing stigma together. That's the title. And Pete Van Duzarts, who I think many of you have probably met before, he is our director of behavioral health and for Programs for Change. He's going to be a keynote speaker along with William Moyer, who's with the Hazelton Betty Ford Foundation. And so that is coming up March 13th from 5 to 7:30 at the Phipps Center for the Arts in Hudson. And I will, it is free, but because of space is limited, it is they're asking people to register. So I'll put the link in the chat and I'll send out the flyer with Kathy.
You're great. Thanks, Steph. And one last Steph.
Hi, I'm Stephanie Lindy Kugel. I'm with North St. Paul Maplewood Oakdale School District. I'm the Project Aware Grant Manager. So our funding funds all of our school-based mental health in all of our buildings. We are in the thick of budgeting, staffing, all of those business things that happens to keep schools running. And we're trying to focus a little more over this coming spring and summer in creating some more tier 1 and tier 2 supports for mental health and social emotional learning so that we're not having these huge wait lists for students needing school-based mental health with our contracted therapists, which they are wonderful, they are amazing, but we need more of them, and there's only so many to go around and so much money. So that's where we're at in 622. And Mary, I love the daffodils in the background there. They've been distracting me. Spring.
Trader Joe's, gotta make a stop. Friends, I am so thankful for you to hang out with us, be here, share. I love that we did have time to do agency updates. I learned a ton. I hope you're making connections also. Quick reminder, our next meeting is also online on the March 25th. We always meet the 4th Tuesday of the month. Mark your calendar, April 22nd, we're in person. So more to come, but watch for Kathy's updates. You guys we need you all. And just a joy. I didn't even get to do any real updates for me, but you'll see them in Kathy's email. So bless you. Thank you all, and we'll be in touch.
Mary, do you want to stop recording?